Do you know which vitamin you need extra of if you have problems with sciatica? I'm going to tell you about that at the end of this video. But right now, I'm going to share with you 3 things I think you should know about this important water-soluble vitamin, that is B2. Hi and welcome to my YouTube channel. I am Kristina, and today I'm going to share with you 3 things I think you should know about vitamin B2. When you get too little of B2, so you get deficient, you can get problems in your mouth and around your mouth. Very characteristic sign that you are lacking B2 is when you get cracks in the corner of your lips. Also, you can get chapped lips, and then it's good to increase your intake of B2, and that will heal your lips and get rid of those nasty cracks at the corner of your lips. Also, you can get problems with your tongue. It can get red, swollen, painful. Can be a sign that the body is telling you you need more of B2. Also, mouth ulcers and mouth blisters. Think of B2 and take extra. And also general inflammation in the mouth and around the mouth can be a sign that you are deficient in B2. Number 2, if you are deficient in B2, you can get problem with your eyes. That is that you can be very sensitive to the light. You need to wear sunglasses every time you go outside, but also very itchy eyes. And it's a special itchiness. It's more like it feels like you have sand in your eyes, or that you get something like a hair or something stuck in your eyes. You really just want to rub your eyes because they feel very uncomfortable. Also burning sensation in your eyes and even bloodshot eyes. And number 3, sign that you can be deficient in B2 is when you have problems with your skin. That is, you can have an oily skin around your nose, and especially down here around the tip of your nose. Also cracked skin at the back of your heels when you get those really deep cracks. That is also really a sign that you are lacking minerals. So usually you need more minerals, but also remember that minerals are important for B2 to do its job. So they kind of cooperate and work together. So to have effective, good results of B2, you also need to add the minerals, especially if you have these cracks at the back of your heels. Also inflammation in the skin and general eczema, and also dandruff. When you have this white scaly skin in your scalp, like dandruff, but also white scaly skin other places. It can be down at the bottom of your fingers or down at the bottom of your toes or your shins. That is also characteristic places where you can have white scaly skin, and that is signaling to you that the body needs more vitamin B2. And then some other general symptoms that can occur if you are deficient in B2. And that is if you get a sore throat without having a cold, without having a flu, you just have this little bit of pain in your throat. That can be a sign that you are lacking B2. Also migraine headaches. Migraine headaches also usually are a lack of minerals, but again they cooperate with the B2, so you also need the B2 vitamin if you have migraine headaches. Neuropathy, when you have this tingling, numbness at the nerve endings, especially your hands and your feet, and it can also be, for some people it's pain, and for other people it can be more numbness. Then you need B2 because it's very important to create this protective layer that we have around the nerves and to keep them healthy. If you did listen to the previous movie where I talked about B1, that is the number 1 vitamin for neuropathy, but also B2 is important for that. And also general fatigue. Remember, B vitamins are so important for our mental, emotional health. So if you feel irritated, worried, depression, it can be always good to try. See if you feel better if you take extra B vitamins. So B2 deficiency definitely can lead to fatigue. But it's also a good idea to look at what could possibly drain your body of B2. And that is fat food. If you are on a low carb, high fat diet, when you eat a lot of fat, you need B2 to break it down. So the more fat you eat, the more B2 you will need to be able to break it down. Also, if you eat a lot of processed food, white flour, white sugar, and drink alcohol, that also are food that really needs extra of B2. Generally, if you have digestive problem, it's a problem to absorb enough of the B2 vitamin, and that is usually the most common reason why people get deficient in B2. They have some sort of digestive problem. It can be anything from irritable bowel syndrome, IBS, or diverticulitis, or inflammation in your intestine like Crohn's or ulcerous colitis, like inflammation in the digestive system. Also, you know, when you have acid reflux, that is a sign that you have too little stomach acid. A lot of people think it's due to too much stomach acid, but it's actually the opposite that is true. So when you have too little stomach acid, you can't break down the food properly, and then you can not get the nutrition from the food, but you cannot absorb the B2 properly. So if you take antacids to have this protective coating around your stomach, know that in the short run, it can be good to just lessen your symptoms, but in the long run, it will worsen your digestive problems and you're lacking in the B vitamins. Also, when you take antibiotics, they kill off the good bacteria in your intestine and can lead to digestive problems. So it's a good idea to take extra B vitamins when you are on antibiotics. Contraceptive pills are known for draining a lot of nutrition from our body, and among them also B2. When we are under stress, like physical, mental, emotional stress, that is the biggest problem when it comes to draining the body of the B vitamins. So when you stress, they quickly get drained out of the body. So a good idea, of course, try to lessen the stress as much as you can, but in periods when you are under a lot of stress, remember to take extra B vitamins. So, what is the best vitamin to take for sciatic nerve pain when you have this nerve pain down the side of the leg? That is B2. So to summarize, 3 things I think you should know about B2. If you get deficient, you can get problems in and around your mouth. You can get problem with your eyes, itchy eyes, feeling of sand in your eyes, or you can get problem with your skin like dandruff or cracked heels. And I also want to add that when you take B2, it can color your urine very bright yellow. So a lot of people think that they haven't absorbed their nutrition when the pee gets really bright yellow. But that is because B2 has a very strong dye. So it will naturally turn your pee more yellow when you take extra B2. It will still do its work and you will still absorb it. I usually compare it to, like, if you eat a lot of beetroots, that will color your urine red, but that doesn't mean that you haven't absorbed the nutrition from the beetroot. Of course you have. So it doesn't correlate with each other. So now you know when you get bright yellow urine, it's just a sign that you are taking B vitamins and the B2 is a strong dye. Remember, when you take the B vitamins, to take them all together, not only B2, because B2 will work better when it comes in balance with all the other B vitamins. So always make sure you take a B complex with all the B vitamins in the right balance with each other. Also make sure you take a nutritional supplement that has a high bioavailability, so you are sure that it is reaching your cells where it is needed. So I hope this was helpful. I'm really glad that you watched this video to the end, and I really hope I will see you next time. And next video, I'm gonna speak about a very interesting B vitamin. I'll see you then. Take care.